Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio. Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
It is 19 hours 30 all across this beautiful country that we call Guyana, and it is time to enter room 592, where we unleash the truth with Dr. Yog Mahadeo alongside his loyal co-host, senior journalist of Kaieteur News, Mr. Leonard Gildarie. We have been spending over 5 months with these two fellas, and we could see their faces will just not age. And for that, they deserve a kudos. And their guests this evening, no stranger at all to room 592, Mr. Oren Gordon, and again, no stranger either, Mr. Lennox Schumann. Good evening, gentlemen.
Good evening to you, Mr. Kevin Smith, and good evening, my co-host, Mr. Leonard Gildarie. How are you, Leonard?
Pretty good. We had Jackie Jackson in the house today. You missed that, man.
Wonderful.
What a wonderful woman.
Yes,
good evening, gentlemen.
Sure,
Mr. Schumann and Oren, how are you guys?
I'm sure it was. And let me welcome also Oren and Lennox to our program. Ladies and gentlemen, wherever you're joining us from tonight, welcome to room 592, where we unleash the truth. It's been an eventful weekend. It's been an eventful week last week. The more you get to let the days go by, the more you're seeing things come to light that you sometimes probably wish you didn't see. But guess what? Today is a brand new day, and we want to have a look at a number of things today, brothers and sisters. Yesterday, interestingly, was the World Indigenous Peoples Day. And one has to remember that there is a segment of the population of the world, not just Guyana, the world, the indigenous peoples, that have more or less put in a corner, and it's only when they agitate and fight, and when there is a World Indigenous Peoples Day, or when there is an Indigenous Peoples Month, that we pay heed to what is happening around the world. And so tonight, ladies and gentlemen, just for a couple of minutes while we wait, the Minister of Health, Mr. Frank Anthony, Dr. Frank Anthony, to be joining us, we are honored that Mr. Lennox Schumann is here with us tonight. Ladies and gentlemen, as you know, Mr. Lennox Schumann is one of the new faces in our new National Assembly that will be announced sooner or later. And so my brother, my friend, my colleague, and Mr. MP, welcome to room 592, sir. Leonard, this is a brand new Lennox Schumann. This is not the Lennox Schumann of yesterday, no. This is a brand new man today. Lennox, joke aside, welcome to room 592, my brother. And
thank you.
And just before I hand over to you for your thoughts, Lennox, if we can spend a couple of minutes under your guidance, sir, and let's talk a little bit about the indigenous peoples, the concerns of the indigenous peoples. And I know that in the past, indigenous peoples of Guyana would have been represented in parliament, but I don't think that in the past, their representation would have been through the agitation and through the sheer broad-based political approach that you have taken, sir, that you have taken on through this elections campaign. So well done to you, and over to you, sir.
Well, thank you, Yoke. As I'm sure you know, and many Guyanese probably don't know, is that indigenous peoples have existed in these parts, in the Americas, for over 30,000 years. And they actually trace indigenous identity back in Guyana to over 13,000 years. In fact, the first civilization that was ever recorded in Guyana, it was actually an Arawakan civilization in the Berbice Mounds, right? When they figured out that those mounds were actually used for cultivation, for agricultural purposes. Beyond that, we had a very complex governance structure. We had our own territory, and people don't know this. All of the Georgetown, the entire coast, was actually part of our people's traditional territory before the colonizers got here. But a lot of people don't understand how far back indigenous peoples go in Guyana. I don't think that we have ever been, I mean, Peter de Geer in the 1950s tried to galvanize the indigenous votes, and then he gave that to the PNC. Then Paul Hardy did the same thing. The gap now went into the PNC. And then out of all of that, we started the Liberty and Justice Party to deal with the very same thing, right? We've never had a political voice. And because of the absence of that political voice, there are a lot of things that we never really see materializing in indigenous communities. Take, for example, the tax dollars that we pay. The majority of it goes to developing the infrastructure on the coast, but yet the infrastructure in indigenous communities are non-existent, right? All we seem to understand is that we're entitled to a school and a health center, right? That's what's happening in indigenous communities. Meanwhile, on the coast, well, we want electricity. We don't want blackouts. We want good streets, right? We want security. We want all of these things. Well, the indigenous peoples want the very same things. And at the time that we started to find how we could deal with equity in that, like in the political landscape in Guyana. Under the previous administration, they had 4 ministers who were indigenous. I can't say that they were effective because I don't have the kind of reach to evaluate their work.
Right.
But I will say from a layman's perspective, they were not very effective at all. That's what we know on the ground. I don't know if there are some other things that they would have done to, which we're not disposed to at this moment.
Right.
But now we come back into this PPP's administration, and there is only one indigenous. In fact, it is not really one indigenous, one person who is half indigenous, and who is now in charge of indigenous peoples. I don't know about their performance and how it's going to go, but we look at the top tier of the current political dispensation is that there is an absence of indigenous peoples there. Someone said, well, you don't know the indigenous people's issues. My counter to that is it would be the equivalent of having a bionic man or robot saying that because they live amongst people, they're programmed amongst people, they know what it is to be human.
Right.
You will never understand the organic issue if you're not part of that system. So it is yet to see what comes out of this political dispensation. I will tell you that I was quite sad yesterday at the fact that President Ali and the PPP administration did not even acknowledge nor did they make a speech wishing indigenous peoples some day of, I don't know, have a happy World Indigenous Day, or maybe projected a plan for indigenous peoples or any acknowledgement. None of that. We just had emancipation. Well, you had that massive emancipation message before Arrival Day, and now we get to Indigenous Peoples Day, and there's nothing. So I've told our folks to just be patient. They're only in their first week, not the first week yet, I don't think.
Right.
Or just coming out now. So
Right.
they're only in the first week. I'm sure they have a lot of things to get done. So I hope that they do not continue with these missteps, because the missteps in themselves are actually very telling as to where you fit into the national political dialogue. So we're looking forward to what comes out.
Indeed, that is well put indeed, because and let me also welcome to you all, ladies and gentlemen, Mr. Oren Gordon, who's here tonight to keep us updated on what's happening in the Trinidad. Sorry? Yes. So we have Oren here tonight, and Leonard, you know, Mr. Schumann said it right. It's not just about representing what the indigenous peoples want, but it is about allowing us as a society to carve a space out.
No, we can't hear you.
Where they could come out and say and be what they have to be. Oren, Leonard, am I coming over loud and clear?
I'm hearing you clear here. You guys are hearing.
I am hearing you clearly. Lennox seems to be having a problem hearing you.
Beautiful. So Lennox, can you hear me now? He's not hearing us. So, Leonard, over to you. That has been well put by Lennox Schumann, indeed, that it has been, you know, the indigenous people may have been represented in a way in politics. They have always been part of the political landscape, but whether they have been allowed to be a part of the national landscape is probably a debate that we need to have nationally. I mean, in the highest level and the lowest level of this country.
Yes, Yoga. You hear one talking to Amerindians and their representatives, indigenous people generally. You would hear a lot of comments like, you know, the only time that we would see you is around elections time, and you hear that quite often. And so this is something that while you might have persons coming from the different areas representing them as ministers or so on, you keep hearing that over and over and over. I think that this is something that we need to continue to talk about. You look at the big United States and around the world, even Australia, and what they're doing with their people there. It is something that you really need to have a discussion on.
Lennox, can you hear us now? So Lennox cannot hear us. And ladies and gentlemen, that has been a little snapshot from Mr. Lennox Schumann on the indigenous peoples. Tonight, we did not invite him here to talk about the politics per se, but we invited him here to talk about the indigenous peoples and how he hoped to represent them within the national assembly, within the political landscape of this country. And I know we have lost Leonard there. We only wanted to have Mr. Schumann here for a couple minutes to talk about that in recognition of this weekend going being yesterday was the World Indigenous Peoples Day. And so that is important. Oren, you would have been across the Caribbean, and just before we get to the Trinidadian elections, sir, your thoughts on the indigenous peoples and how they might have been represented both in your past here in Guyana, and are there remnants of various indigenous peoples in any of the islands, would you know, sir?
Yes, there's a significant indigenous people's presence up and down the Caribbean, including here in Trinidad and Tobago. And the debate in some of these societies has been whether to move Columbus out of the picture and pay more attention and more, more reverence, I guess the word is, to the contributions of indigenous people.
Mm-hmm.
And that is an increasing debate. Do we have in Guyana a holiday dedicated to indigenous people? I don't think we do. Correct me if I'm wrong. I know that Mashramani
don't. We have a month that is, and it's known locally as Amerindian month, but it's a month of for our indigenous peoples. And interestingly, Oren and Leonard, somebody raised it with me yesterday on social media. Mm-hmm. Why is the Indigenous Peoples Month of Guyana and the Amerindian Month and Amerindian Day in Guyana different from the world, the Day for Indigenous People?
That is exactly the point. It seems like an afterthought, doesn't it?
Yes, So that is something that we can continue the discussion on, of course, Oren. And ladies and gentlemen, I tell you what, we will be joined in just a few moments by Dr. Frank Anthony, the Minister of Health. And he's going to give us an update on what's happening in the health ministry. He's a new minister, as you know. But just before we go there, Oren, what's happening over at Trinidad, my brother?
The polls closed coming up to 2 hours ago, nearly 2 hours ago, and they're still counting. If the local example, if the Ghana example is anything to go by, we should have a declaration by Christmas. But
no, come on, you don't have any.
No. You've been a pessimist now, or
no. That won't happen. We will know tonight who won and who lost. The polls point to both a narrow contest between the governing People's National Movement, which has 23 seats in Parliament, and the opposition UNC, which has 17 seats.
Right.
But the polls do point to a PNM victory. By all indications today, and certainly in the marginal constituency of Chaguanas East, in which I live, the turnout was high, surprisingly so. And this is a topic that your next guest will address. Surprisingly so, given the fact that there are pandemic restrictions and ease of voting is it's not necessarily that easy to line up and to cast a vote as you normally would do.
Mm-hmm. Indeed. So I heard that today, and that is interesting, Oren, that the turnout has been phenomenal. I mean, people are becoming very engaged in the politics of their country, which is very good.
As I said, the turnout is good, and you are experienced enough to know, both of you gentlemen, when turnout is high, it scrambles all pre-poll predictions. So we will have to wait and see. It's pretty early in the evening. It hasn't been 2 hours yet since the poll is closed. I'm watching our friend Wesley Gibbings, who was here last week with us. He's on Trinidad and Tobago television, but there are no returns yet. If you remember last week, we had an analyst, a Barbadian Caribbean analyst, Peter Wickham. And he said that he reckons that 8 of the 41 seats are marginals, and they could all go in one direction. They could be split down the middle, or they could all go in the other direction. It's really early days here.
And as we welcome our minister to room 592, let me just acknowledge Kenneth Lau too, who says that Trinidad will have one up over Guyana tonight because the losing party will concede before the official results.
There you go. I had a bet that I wanted to lose, and I'm glad I lost the bet. Okay. When Dr. Rowley announced the August 10th election date, I said, the pessimist in me believes that they will get their election results before we do, and I'm glad that I was wrong.
I hope that you pay up.
Great. Well, ladies and gentlemen, let me remind you, you're in room 592 where we unleash the truth. And tonight we want to have a talk. Look, the truth is that, we were inclined, and all the ministers have signaled that they're very, very willing to come and share information with you all. But we thought that priority for this country, for us, from the viewing public and the listening persons, is health. And so we did invite Minister of Health, Dr. Frank Anthony, and he had no hesitation about coming here, coming in room 592 to tell you about where we are, what is the bill of health for this nation? What are we looking at? Is this nation, sick? I mean, and we don't want to go into the mental side of things, Minister. But brothers and sisters, the health of our nation, you would have all remembered that over the past 5 months in room 592 and on elections watch, a lot of persons were calling in, complaining, no medications, pharmaceuticals were missing, people with diabetes could get nothing, people go with pains and cuts and all kinds of things to the hospital, and they didn't even have aspirins to give them. So now, we can't blame APNU AFC now anymore, right? We have the man who is going to say, if things go wrong, blame me. And so, Minister, welcome to room 592, sir. And I will hand over straight to you to tell us what is happening in health. And first of all, what did you find when you opened the door and go in, sir?
Thank you very much, Yog. Thank you very much, Leonard.
Thank you, sir.
Oren. I am very happy to be here with you to perhaps talk to you about some of the things in health. The picture is not pretty, let's put it that way. Because as you said in your introduction, a lot of people were calling over the months, complaining about shortages and so forth. And that's what we're finding, because now that we have an opportunity to talk to the technical people and to review some of these programs, what we are seeing is that it's probably far worse than what we had anticipated. So for example, in terms of medication, most of the medication for chronic what we call chronic non-communicable diseases. These are things like diabetes and hypertension and heart diseases and so forth. Almost all those drugs are in short supply. And in some cases and in some, for some of the items, they have nothing, right? So this, however, I think was masked because, you know, a lot of people, because of COVID-19, they were not going to their health centers regularly. And even those who went, in many cases, they were being turned away because the health workers were telling them, well, you know, because of this pandemic, we can't see you. And therefore, in a lot of ways, this would have masked the true situation. And maybe the few complaints that you had were not really reflective of the magnitude of the problem that we have at hand.
Right.
And so we have a major shortage of drugs and medical supplies in the entire system. And that is one of the priorities that we'll have to try and see how we can quickly sort that out. In terms of, you know, the last PVP government would have done quite a lot of work with HIV. We were able to introduce antiretroviral medication for persons who needed it. You had tests that were being done. In fact, we created things like National Testing Day, where thousands of tests were being done on that day. As it is right now, we have a shortage of HIV test kits. Can you imagine that?
Wow.
HIV test kits are in short supply. ARVs are in short supply. So persons who would have been put on these medication, they would have difficulty to maintain those regimens. In terms of TB, for example, another infectious disease that we work very hard to control, we have shortages of those medication as well. So when you look at this situation from a point of view of shortages, throughout the system, there are shortages of various items. And I haven't been able so far to look at the actual situation in some of the regions. And you know, because of how medicines are distributed, generally in the hinterland areas, you would have problems in terms of taking these medication out in the best of times. So you can understand now, if the entire system has shortages, the kinds of difficulty that must have been taking place in the interior communities.
And Minister, I think under the PPP government, you guys would have instituted a robust regional health system that I think was cast aside when the government changed in 2015. Is there any semblance of the kind of, because I know one of the things it served was a kind of a roll-up reporting so that you as minister and your CMO and so forth gets the snapshot at your request of things across the country. Is that, are you finding that still available?
Well, we'll have to probably change back the system to what it was before. But just sticking perhaps with the drugs and medical supplies, when the APNU AFC came into power, one of the things that they did was to allocate to every region a drug budget. So basically, if, for Region 1, if they were going to give them $100 million to buy drugs and medical supply, they put that in the regional budget.
Right.
Now, what we were doing, we were putting it under the Ministry of Health so that the Ministry of Health can make bulk purchases. Because when you buy in bulk, you're able to get better pricing and a whole host of other things.
Economies of scale.
Now, right. So now one of the difficulty with this new system that they put in place was that you send the money out into the region. The region would take a part of that money and they would buy what might be emergency needs for things that they needed right away. They'll buy few items at a high cost because they're not benefiting from this, economy of scale. and then they'll vie back the money to the Ministry of Health, the rest of the money.
Right.
Basically, you will have a time lag of a couple months because it goes out into the region, then from the region, come back into the ministry, and then they will have to make purchases. So in the best of times, you had a time lag with how the money was going to circulate. And therefore, that is why earlier in their administration, they were having all kinds of hiccups with supply of drugs and medical supplies. But what I'm discovering, it's far worse than that, because I suspect for maybe about 2 years, they actually haven't bought anything. So what you have now is nothing was bought for a period of time. I'm trying to get all the details right now so that, you know, we can get accurate information out to the public.
On top of everybody's concern, Minister, as much as you're trying to get a grasp of the holistic health situation in the country, on top, of course, of everybody's concern here is COVID-19, because we here, Leonard and I, on the program, we would have expressed great dissatisfaction with the way information was coming to the people. Can you just take us through it, what you have done? Has the last COVID task force been demolished? Is there a replacement? Tell us a little bit what COVID.
So a couple of things. The response mechanism that the APNU FC had was a very bureaucratic and disjointed one. You had different tiers. So you had something at the office of the president that was called a task force. Basically, it was highly political. You had most of the members of the cabinet being part of that task force. Then below them, they had a very extensive, what you might say, secretariat. But that secretariat was not fit for purpose, because a lot of the people who were in there were basically political people. I don't know how much they knew about COVID and infectious diseases and so forth. I guess they were put into that secretariat so that they'll be able to get a big salary. And so, for example, one of the persons who were in this secretariat is one of the APNU agents who were in the tabulation center. You remember there was a young army fella who was there on the first day. I think he said I was trying to to have some secret meetings or something of the sort. So he is one of the persons who was being paid by the secretariat. Now imagine we are paying this man to go do work in COVID, and instead of looking after COVID-19, he came to the tabulation room and sat with the rest of us for 34 days observing tabulation. Now, there's nothing wrong with him observing tabulation, but he shouldn't, you know, he should be doing the work that he was paid to do.
Right.
Obviously, the taxpayers of this country was not paying him to go observe, you know, elections on behalf of APNU AFC. He could have taken leave and do that on his own time and so on. Nobody would have had a problem with that. So I'm making that point to say that many of the people who were in the secretariat of this task force were political people. And really, they weren't doing anything relating to COVID. They were probably drawing a salary and doing other types of activity.
Right.
And you have
So Leonard and I, we did mention that, because Leonard, you remember we decried the fact that it was politicians who held those titles. Minister, is it? I hate to bring this up to you, but are you going to have the executive authority like your predecessor? Are all the test results going to have to come to you first before the patients know whether they're positive or negative?
Actually, when I took over, that system was still in place. So I have given very explicit instructions to change that system, because I really believe that once the test is done, from the lab, we need to do, the results need to go in three directions. The first one is to go directly to the doctors who are treating so that there's no hesitation. They would know the results and they can take the measures that they need to take in terms of treatment and care. That's the first set of people who ought to get those results. The second set of people who will be getting those results are the unit that is tasked with doing contact tracing, because they need timely information if somebody is positive, to make contact with them and then to interview them to make sure that we find all of their contacts so that we can trace and make sure we are on top of this. And then there's a unit that compiles the cases and so forth. So one of the copies would go to that unit. So it doesn't have to come to me. And I've given those explicit instructions so that people know that this is what you need to do. You don't have to send results to the minister's office and then the minister would disseminate it. That's a total waste of time. We are wasting valuable time. And in the meantime, you can really get it out there to the people who matter and make a difference in some cases to the patients who need care.
Yes.
And so, then to remind you that you know what has been found to have been a bureaucratic process was when tests are conducted, the test results had to go to the minister first. Minister, well, you are now the new minister. Minister Dr. Frank Anthony, who is the head of the COVID task force now?
The head of, well, it's not called that. We have a policy body at the top where the Prime Minister is chairing. I am on that as a co-chair, and we have Dr. Ramsamy who's there. In addition, we have Mr. Ramesh Duku, who is representing the Private Sector Commission, and we have Dr. William Adikro, who is from the Pan American Health Organization. We have the resident UN representative on the body, and we have a representative from CARICOM, who is also on that body. And the reason why we have blended it, so to speak, with a mixture of government, international bodies, and private sector is because each of these agencies, if you like, for want of a better word, right. each of these stakeholders, they bring an important component of how we should be responding. So for example, the UN system, they have done a lot of work on socioeconomic impact, looking at vulnerability of population, migrants, and a whole host of other vulnerable people. And we want to have that in our response and when we are crafting policy and so forth. In terms of CARICOM, COVID, we cannot operate in a vacuum. And our Caribbean neighbors, if we are going to be doing opening up of airports and things like that, we have to do it in tandem with other countries in the region. And therefore, having CARICOM on board is a very important way of synchronizing what we are doing. And of course, our partnership with PAHO. PAHO right now has been helping us to procure some of the needed supplies. And I must tell you that through the Indian government and the World Bank, the Indian government would have donated $1 million to this response, to Guyana's response. And PAHO has those funds and is using it to buy supplies. We also received $1 million from the World Bank. And from other agencies, there's another 500,000 or so. So right away, we have a pool of fund that PAHO is managing, and they're getting critical and needed supplies for us. So you asked me earlier about some of the quick fixes that we were trying to do. One, our testing capacity was quite limited and still is, and we are trying to fix that. So the machines that we have at the National Reference Lab can probably do maybe about 80 tests or so per day. Well, Basically, when they do one run, they will run that for a day. We are trying to add more capacity, and hopefully I can lift that capacity to about 300 tests per day. And that's what one of the things that we are working on. In terms of PCR machines, you would know when we were talking about PCR machines, we were saying we did not have enough. We have 2 right now at the reference lab. A third PCR machine, and I want you to listen to this very carefully, was sent in by the International Atomic Agency for us. And this thing came in and was lying on the wharf while we have a raging pandemic in this country. This piece of vital equipment was sitting on the wharf for an extended period of time.
Do we have an idea how long, sir?
I would get the exact time and let you know. But we have been able to find it, retrieve it, and we have brought it into the lab, and we are going to shortly try to put that into operation.
Sir,
That surely was one of the casualties of the political impasse, right?
Yeah. And so one is that, and we have a fourth one that is coming in. So with these machines, we are going to try to scale up our response, but machine alone, it's not going to help us, right? We need technical personnel to be trained. As it is, we only have 2 persons at the lab who were doing these PCR. And as you can imagine, they have been overworked. So as of this week, in collaboration with PAHO, we are going to be training medical technologists that exist within the system. And we are extending that collaboration as well to the private sector. So if they have medical technologists that they would like to train, we are hoping that we can train maybe 20 to 30 persons to be able to do PCR testing. PAHO is going to have a consultant out of Washington who's going to be doing this training, so that maybe in another week or so, we'll have a number of other trained persons. Test kits. When we got in, the kits, we had maybe about 1,000 test kits, which wouldn't have lasted very long.
Right.
So we have started right away to mobilize more kits. You would have heard during the president's speech that he spoke about Barbados making a generous donation to us. So we have gotten a couple thousands from Barbados. This week, we are expecting about 10,000 more test kits from PAHO. And by the end of the month, we are hoping to have 10,000 test kits, 40 more thousand test kits coming in from PAHO. So that would give us a good stock to handle immediately and to scale up testing if that needs to be done.
Great.
So right away, one of the major things that we wanted to do was to try to scale up the testing response. And this is why you would have seen so much concerted effort in this direction.
Right. Thank you, Minister. Just 2 questions more on the COVID thing then. One is, are you hoping at any time to start establishing a baseline so that you know what would be your numbers there from and how early you would expect to get that done? And of course, the second one is not a question, it's a comment. Yes, we heard we heard President Ali said that there'll be more than 40,000 kits available. In addition, a whole set of PPEs are going to come in, and you're building a robust COVID response all across the country. My second question, one was baseline, and second question then is, are you hoping to have deployment or test centers around the country, or will you still be centralizing it?
That's a very good question. One of the things that we have to do, these tests, to do them, the laboratory would have to meet certain requirements and certain standards. And some of the labs that we have out in the region would not meet those standards as they are right now. So we have looked at another location where they have a lot of the things in place, and we are going to be moving some biohazard cabinets into that area, and trying to make that one ready as well. So not just the reference lab, but we'll have another location where we can do testing. So we are trying to increase it in that way. In terms of having maybe regional hospital, that we will have to look down the road because of all these infrastructure that we have to put in. Now, another bottleneck that we'll face is that every time we try to install a testing cabinet or a biohazard cabinet, we have to certify it. And the certification would have to be done by international people. So we'll have to fly somebody into Guyana just to come in to certify these cabinets, to say they don't pose a hazard to the staff and so forth. So that too is one of the key challenges that we are having. Now, in terms of baseline, well, you would know the accumulated numbers that we are having. But once we start testing and testing more, we will see increase in numbers.
Right.
So one of the things perhaps I want to say to your viewers and listeners, there are regions that we didn't see many cases. That does not mean there aren't cases. All it means is that because we weren't testing, we don't know, right? So once we start expanding testing, we will see some of the cases go up, right? And right now, we are concentrating a lot of our efforts in Region 9, 8, and 7, because these are some hotspot areas that we have identified based on our surveillance. And you would know that in Brazil, they're averaging maybe about 56,000 cases per day.
Mm-hmm.
In the state of Roraima, one of the reports that I've seen, 1 in every 4 person have tested positive or are deemed to be positive.
Wow.
Right? So what you have there is a very high prevalence of COVID-19 in the state of Roraima. And because of the long borders that we have between Guyana and Brazil, you can imagine that people are crossing over back and forth.
Mm-hmm.
And that can create a lot of problems for us.
Correct.
So that's an area that we are looking at. We have to do a lot of education there. We are right now developing material in the Amerindian languages so that we can put that on radio. And we are trying to get some people who have influence in the community, like the Tushaus and so forth, to work with them so that, you know, they can explain to their community the risk that they face and so forth.
Great. Well, thank you for that. Interesting, because ladies and gentlemen, please note that we will have 40,000 test kits. As the minister says, when you start to use those 40,000 test kits, you are obviously going to see an increase in the numbers, because then you're going to get to the true status of how much at risk people are in different parts of the country. Minister, let's talk a little bit about social side of things. So we have seen the seawall gatherings, we have seen the rum shops, we have seen places where people still gather. Now, it is a ticklish thing for your government, because now coming in government, if you are to clamp down hard, people might want to say, well, it was easier back then. How do you guys plan to get people to be conscious and to not assemble walls and all over?
Well, in my mind, it's not ticklish.
Okay.
The order that has been in place is still in place.
Mm-hmm.
Because COVID is not going to make an exception of anybody, right? We know the ways of how this virus is being transmitted. And if you want to be irresponsible, don't wear a mask, don't keep your distance, don't sanitize your hands and things like that. At some point, you're putting yourself at great risk. And so what we saw on the seawall and the way people are behaving, that is highly irresponsible. So one of the outcomes of what we did see there, we had a very high-level meeting this morning. Prime Minister chaired the meeting, and we met with the Army, the police, Minister Ben, and some of the other key stakeholders. And we spoke about these things. And so hopefully you will see more enforcement. But you don't have to get, I mean, look, this thing here, people got to start being responsible. You don't need a policeman to come and tell you, wear your mask properly. You don't need a policeman to come and tell you, keep your social distancing. By now, people should understand the basics of this disease. And they should be abiding, because if not, we are going to get an increase in cases, right? And if you think that we don't have problems in Region 4, we do. Because recently we had a case in Georgetown. We had 2 cases up on the East Bank, and people got to be cautious.
Correct.
Right? So I want to use this program to appeal to people to do the right things and to be responsible. I understand some bars are opening. They shouldn't be, right? And people have to take this thing seriously, because you know what? If they don't, we are going to see an increase in cases. It's simple as that.
So, Minister, on the work side, because remember, your government is also keenly interested in looking at how we can stimulate some economic turnover.
Yes.
So, is there any thinking, that you are going to have inspectors? So, for example, at the bank, because the banks or other workplaces, because you got to be interested in the health for the people who are seeking services as well as the service provider.
So one of the things that we have been working on, and we'll have to do this for almost all the sectors, those that would be working, what are the measures that you have to put in place to work safely, right? And we, you know, for different industries, different businesses and so forth, there might be slight variance. So we have to put together a lot of those protocols, and then we have to explain that to people and get the industries to work with us on it. So for example, I'm just using this as an example. I met this morning with the Guyana Mining Association. Now, they are a key stakeholder in the interior, and we are going to be finalizing some protocols with them, and then we'll put it in place, right? So far, all the stakeholders that I've met, everybody would like to work with us. Everybody would like to know that they're putting in the right set of protocols and so forth, and collaborate with us. So that's one of the things that we are in the process of doing, working with different stakeholders, looking at the particular industry and see what are the measures that we can put in place so that people can work safely.
And Minister, if I may, could you tell us, based on what you're seeing right now, whether it's a good idea or what would be the format under which school would be reopened? We want to hear that from you.
Right. So we had a technical meeting between Ministry of Health and Ministry of Education. And that technical group right now is putting together a set of things that the education sector would have to meet before it reopens. We in the Ministry of Health, we are laying out some basic minimum standards that we feel schools should put in place before they can reopen. So I guess in a short while, give us a little bit more time. I mean, I can talk and tell you some of the things that we're looking at, but I don't think that would be fair at this point in time. But I want to assure you that we are not going to just make that decision very lightly. We are going to take a lot of things into consideration, because you have to understand that once we reopen school, and if we reopen all the schools, we are literally putting maybe about 200,000 children on the road. Most of them would have to use public transportation and a whole host of other things. So unless we can reopen safely, then that's something that, we'll have to look at.
Has there been any issues raised about the reporting? Every day there was reporting in the past before this administration went in, and there were concerns whether there should not have been more information as to specific areas which were highlighted, and maybe we give details. What is the thinking of this administration?
We are going to, we're right now trying to put together a system where you will have timely and accurate reporting. But as you would appreciate, sometimes the way these tests are collected, taken to the lab, the time it takes to process, it varies and so forth. So we're trying to standardize, collect information, and to be able to give that. Now, while that is going to be done, I know people want all kinds of detail. In some cases, we would be able to release, I would say, information maybe on some general things like regions and so forth. But to give you specific village and which house, I'm not going to do that. Because there's a level of confidentiality too that we have to put in place to respect people's privacy. And we don't want, because easily people can be stigmatized. Right? So there's a balance between some level of privacy and confidentiality, and at the same time, assuaging the public concern to make sure that people can get timely information. So it's that balance. It's not that we don't want to share some of these things, but you have to have that balance.
Right. Interesting. And I think one of the things that the country would want to see going forward is regular updates, regular communication with the people. And I would want to extend an invitation to you, Minister. You're welcome on this platform at any time, 5 minutes, 10 minutes for us to share. Oren wants to interact.
Yes, I have a perspective. I live in Trinidad and Tobago, as the minister probably knows. And the government, which is being put to the test tonight, one of the things for which they were credited, apart from aggressive pandemic control, is facing up to the Trinidad and Tobago public every day. Every day, the chief medical officer, the prime minister sometimes, but certainly your counterpart, Terence D.L. Singh, every day. And what that served to do was to instill confidence in the population and to clarify certain messages about behaviors and policy changes and that sort of thing. It's a big ask doing it every day, but do you see yourself engaging in that level of communication?
So I have discussed this with my senior staff, and every day we are going to either have, I think that has been happening, either the chief medical officer or the deputy chief medical officer who would normally give the results. But I have said to them that once a week, I want to have a program, a virtual press conference, so to speak, where the press would be invited. And I know that you will have all kinds of questions that you want to ask pertaining to COVID. And so we'll have that session where you, once a week at least, we can have an extensive question and answer period where you ask and we try to respond as best as we can. And I'm hoping that would give you enough information. Look, the bottom line here, as with any public health crisis, we need the media as our allies. And the more you know, the more you would be able to explain that to the public, right? Because we are all in this together. And if you can help us to get that information and to help us to educate people, that would be helping with a big part of this job.
Indeed, I've said to my media colleaagues over here, we don't have a side. It's in everybody's interest to beat this thing. So we're not biased one way or the other. We all want to beat this thing. So what are the raw numbers as we speak today, Minister?
I am trying to get those numbers. I think they probably released them. I don't have them right now.
Okay.
Right.
Yeah.
So, Minister, thank you for that. On a lighter moment, I just want to throw this at you, knowing you're going to have a good laugh here. Is the Turkine Leonard still the epicenter?
Oh, they.
You remember during the recount time that was supposed to have one time been the epicenter, right, for COVID-19?
Well, you know the obvious reason, because they were trying to deter people from using the convention center. As it is with some of the silly advice we got about why we should only have 10 counting center and you should change your mask every 30 minutes and all these nonsensical kind of advice. Hopefully we will get, you know, we're streamlining the process so that, and this is what I've been saying to my team, that look, we have to give professional advice, professional health advice. The minute you deviate from that and you lose the confidence of the public, then we are in bad shape. So every one of the persons who will be going out there, we have to give that kind of, because if we know about the disease and transmission and so forth, all of us, we have to talk about these things so that we can help to educate the public, right? And I think that's our approach. We're going to be very open, and you will be seeing many more faces because we have different people working on different aspects of this. I'm trying to be as inclusive as possible. So I have a team of clinicians who are working on clinical protocols. I have some lab people who are dealing with laboratory things. So we are opening up the system. You know, as I said to somebody today, we have the Ministry of Health. We have a lot of professional technical people. But if you don't give them leadership and utilize their skills, we are not going to bring it to bear. And we need to harness that and to, you know, use it for the public.
Yog, I had some questions for the minister, but he hit the ball out of the park every time. I had a question on testing. He answered that. I had a question on the border communities. He answered that, because I don't know about Suriname, but 2 of the 3 countries with whom we share borders, with which we share borders, have very serious
But Suriname,
to varying degrees.
Yeah. Well, Venezuela, we don't know because Venezuela has not been giving numbers to the WHO, so we are not sure.
The reporting out of Venezuela is that it's bad, but not as bad as Roraima, 4 and 10, as you said, but it's bad enough.
Yeah, and in Suriname, I think they had about 2,000 cases or something. They had 28.
Yeah.
So we had very good meetings with President Santoki and Foreign Minister Ramdin, and we are going to follow up at the health level, and hopefully we'll have closer collaboration in terms of working closely with Suriname, you know, in terms of managing the border.
The challenge for us is that our borders are unpoliced. I remember many years ago in the dry season, walking across the Kaieteur into Roraima State. So that's a problem.
I think it's 1,000 miles. I think it's 1,000 miles they're talking about with the Brazilian border. But Minister, very quickly, based on what you're seeing here, and I know it's, if you could hazard maybe a caution to the people of Guyana, based on what you're seeing here, how long should we be strapping in ourselves or buckling up ourselves for?
There's a simple answer to that. And the simple answer would be that until we get an effective vaccine, we have to be prepared to have certain restrictions on movement, on wearing masks and taking these precautions, right? When we get an effective vaccine, then we'll have to get access to that vaccine, and then we'll have to be able to immunize, so to speak, a high percentage of the population so that we get what is called herd immunity, meaning that it will be difficult for transmission to occur. You know, internationally, what we're seeing, there are quite a few vaccines that are in development. Some are in phase 3 trials, and people are very optimistic. Some people are hoping that by the first quarter, we'll see some of those vaccines coming out, being rolled out. And once that happens, I think, then, and we're able to access it, then maybe we can relax. What is also very good is that through the Gates Foundation, they've been working with Gavi and CEPI and some other international bodies. And Bill Gates, through his foundation, has been able to procure certain vaccination factories, if you like, in India, that once we get an effective vaccine, they'll be able to scale up the production of it. And they have already started contacting countries to talk to them about eligibility and how they can participate in this vaccine program. We have been contacted and we have been engaging them, and we hope that as things become clearer, we will also be very much part of that initiative. So I want to let you know, we are not leaving any stone unturned. We are looking at various aspects, lab, PPEs. We're looking at types of medication, what we can do, how we can do it. We are looking at in the future, when vaccine become available, we are already planning for that so that we can have that also in Guyana. So we're ensuring that all the things that you need to have in the arsenal to fight COVID, that we have it.
Great.
A quick question, if I may, with the indulgence of the two hosts, Minister. The question of behaviors, are people masking up, social distancing, and that sort of thing? I noticed that the president himself has been setting the example, as did his predecessor, President Granger, with wearing of masks, elbow greetings, and that sort of thing. But is the message getting through to the general population, and are they acting accordingly to your satisfaction?
No, not to my satisfaction, because we need to do more. Because, I think some people, we need to educate more. So here's a good example. Somebody would have on a cloth mask, and then they pull it below their nose, right? And they're moving around quite comfortably, but the mask is just covering the mouth, and the nose is exposed. So we know that that is not going to be effective. They're putting themselves at risk. Right. You have other people who are wearing the mask on the chin, right? So what's the purpose of the mask then if you're wearing it on your chin?
It's an accessory.
Yeah, and when you look around, you can see many examples of that. So we need more education.
Right.
We need different people to be talking to different constituency, educating them about the need to do this, right? And then we can have an assessment of risk. So, if you're by yourself in a room, then the risk is very low. If you're in a room with other people, then you have to take certain precautions. So you have to judge risk. And I don't think people have been doing that very well. And so these are finer points in how we need to educate the public. But masking is one thing, we're saying it. And in health education, there's an interesting phenomenon. And that is when you will test people. If we go and conduct a test right now and ask people about COVID and do you need to wear a mask, all of them will tell you yes, right? But tell them to practice it. Or if you have a question how to tease out whether they're practicing it, and then you will see you have a high percentage of knowledge, maybe 98, 99% in knowledge, but you will see that in terms of behavior change and practice, that it's much lower.
Right.
So sometimes knowledge is not automatically means that you'll have behavioral change. Behavioral change come when people internalize the messages that we are trying to get over to them. And I think while some amount of awareness was there, we need to now design programs so that people can internalize the things that we are talking about.
Yeah.
Well, thank you for that, Minister. And I know we did promise you just 30 minutes because you have some other meetings, late night meetings you have to continue. A lot of planning and work has to be done. Or apologies for keeping you back. I would ask
That's
you
okay.
one final question, and of course to look forward to your future engagement, sir, because we want to talk to you about procurement and a number of other things within the health ministry. But for now, I would ask for your final comments on chloroquine and hydroxychloroquine. Just open comments if you can, and also your closing comments because I know you have to go.
Well, hydroxychloroquine, let's wait a little bit because I have my clinical team that is working on that. So let's see the guidelines that they'll be putting out. By the end of the week, we should have those guidelines. And these are the top medical specialists we have in the field. So let's allow them to develop those guidelines and then we can come back and talk to you. Because once we develop those guidelines and everybody is comfortable with them, we'll issue them as national standards.
Great.
All right.
All righty. Well, Minister, thank you so much for being here. And on behalf of our population and public, watching public, viewing public, we thank you for the information you have shared. We certainly look forward to your weekly press conference on this because we all want to help you. We have preached in Room 592 that ultimately the cure to COVID-19 or the best way to defeat COVID-19 rests with each and every one of us and our responsible action. Thank you, Minister. It's been wonderful to have you here, sir.
Thank you.
Thank you all. Yeah, bye-bye. So, ladies and gentlemen, as the minister would have told us, the COVID-19 restrictions and the various practices and all of that we have to have in place still remains in place. The curfew hours, the closure of the non-assemblage of persons in public places, the way we travel together, the way we work and so forth remains in place. And I must remind you, tonight we have a tri-part of our 592. The first 10 minutes we dealt with the indigenous people, just an update from Mr. Leonard Schumann. And then we had an update from the new Minister of Health, Dr. Frank Anthony. And now we're going to look at the elections in Trinidad and Tobago. And my brother, our friend, Guyanese-born Orin Gordon, sir, tell us what is happening there now.
Well, some early figures are coming in, and there is one little surprise out of the many. I will get to that in a moment, but let me emphasize these are early returns.
Right.
The safe seats are being safely held by the incumbents, the United National Congress, which is mainly an Indo-rural-based party. That is its origins, although it has evolved somewhat over the years. They are holding the heartland seats. In the seat in which I live, which is a marginal, which is held by the UNC, their candidate, Vandana Mohit, is leading her heavyweight PNM challenger, Senator Clarence Rambarat. Early returns. Let's extend the program to midnight and we can have the results in full. I joke about that. In San Fernando West, however, the Attorney General, Faris Al-Rawi, is trailing his UNC opponent. Early days yet, but that could change. I'm keeping a close look at the marginal seats that our analyst Peter Wickham talked about last week, and so far there have been no surprises. We've just seen the opposition leader Kamala Persad-Bissessar with a comfortable lead over her opponent in her southern constituency of Siparia. We've seen Dr. Rowley leading his opponent comfortably, but in the 5-person race in San Fernando West, Faris Al-Rawi has got some work to do. He's one of the government heavyweights. He's one of the heavy hitters in the government. And if he was to lose tonight, that would be the big news. But the returns are early. Can I remind our listeners that it is 23 seats held by the governing People's National Movement, 17 held by the United National Congress, 1 by the Congress of the People, the seat of St. Augustine, the home of the University of the West Indies, 4-1 seats. And let me sing my usual song. I wish that one of the things that we did for constitutional reform is to have a constituency system. I am dying to see Leonard Gildarie as the member of parliament for Kitty and Sir Brian. So
I don't know why you keep naming that. Why not Grove and Diamond? I don't know. Yoke, any idea?
Well, let's leave that for a discussion over coffee after COVID.
Yes, yes, yes.
no, but you got my drift.
Yeah.
I don't know. I don't know where Leonard is from. I should ask him before I say it, but I'm just being mischievous.
Yes.
Leonard would want to tell you he's from three places, one of which he wouldn't want to share with you.
I went to my Coney yesterday, and that's a beautiful place. And I think I came somewhere from there. I lived in Enmore for a little while, and I like Grove Diamond where I live now.
Okay.
Correct. So, Aaron, tell us a little bit in terms of Dr. Rowley's constituency. He certainly has a comfortable and is expected to hold that comfortable, as is his political opponent,
right.
There'll be no surprises there. But in terms of the marginal areas, is it early days? Are you seeing, other than the one you mentioned, are you seeing any other of the marginal ones, that it would swing maybe opposite to what you might have thought?
I expected Senator Clarence Rambarat to be putting up more of a fight or having a closer contest with Vandana Mohit. She's the mayor of Chaguanas, a town in the center of the country. She's 30 years old, and he is a vastly experienced and much academically achieved member of the cabinet. But so far, she is leading him quite comfortably. There have not been returns yet from the other marginal constituencies, unfortunately. You'll see me glancing up now and again. The television is in front of me, and now and again the graphics flash up, but I haven't seen anything for the marginals. The marginals will be the last to be declared on the night, because the margins are going to be very small, so they're going to be very, very careful counting them. But very boringly, I suppose the safe seats are being held. No surprises there. The one surprise is San Fernando West, where the Attorney General is trailing. And the slight surprise for me is that the Chaguanas East constituency, in which I live, which is sort of half town, half rural, is being comfortably held so far by the UNC candidate. Gotcha.
So tell me something, just for our education here in Guyana, because this is, as you say, this is a constituency-based elections in Trinidad and Tobago. So very, very different from what we got used to in Guyana. Let's take Diego Martin, the northeast area there. Now, you have a plethora of small parties like we did, or new parties like we did in Guyana. In fact, you have 19 parties contesting the election. Now, in some of these areas, looking at some of these numbers, we're not seeing any threats to either of the two main parties.
No, the small parties are doing very badly tonight, I have to say. What I hoped for, was a breakthrough win by one of the small parties or one of the independents to shake up the political establishment, to shake up party, but to shake up the parties. But the small parties are doing very badly. I just saw a return in San Fernando, in one of the constituencies. I can't remember which one right now, because it's gone from the screen. Two of the small candidates have 0 votes. Wow. 0 votes.
Why do you have done so badly in Trinidad and Tobago?
I don't know. People are tribal in a way that we are in Guyana. And I'm sorry that Lennox is gone from the chat. I'd have loved to be kicking some of this around with him. Some of the small parties, they made a lot of noise, and you expected them to do better, but they're not having a good night tonight. You mentioned Keith Rowley's constituency. We know from our geography how Trinidad and Tobago is shaped. In the northwestern peninsula, that is the constituency that the Prime Minister represents, and it is by far the richest constituency in Trinidad and Tobago. It's got Carenage and various other very, very wealthy areas that are populated by folks that the rest of Trinidad like to refer to as the 1%. And this is the constituency that Mr. Rowley represents. Ms. Passad Bissessa represents a far more rural southern community. They've got a really nice beach down there as well. So there's another constituency that we're looking at Couva North as we speak, and predictably that used to be Bazio Pande's old constituency, and predictably it's being comfortably held by the UNC. Maruga Tableland in the south is held at the moment. That was a marginal last time. It is held by the People's National Movement, and that is looking to be a close race. That one could flip into the. There's a good chance that could flip into the UNC column. Faizabad, which is a UNC constituency, is running surprisingly close. The PNM candidate there. Faizabad is in the south. It's in the oil country of Trinidad and Tobago. That is a UNC constituency, and that one is looking pretty close at the moment. But I don't want to make any misrepresentations. It's early, and we're not close to having the final figures yet. But there are one or two areas that are looking interesting right now, and Faris has got some work to do.
Okay. At what time tonight would you expect that you would know where this election is going?
Around 10:30 or so, we should get some settlement and some clarity on this.
Right.
Roughly that time.
Here is my follow-up question to my earlier one on the small parties vis-a-vis the constituency system. Theoretically, a small or a new party should do well in a constituency-based system because it is constituency and not big umbrella.
The voters feel more comfortable in the embrace of one of the big parties. I mean, one of the criticisms of the Rowley government is that the PNM holds some of the poorest constituencies, such as Laventille and various other impoverished areas. And I hate to bring race into this, but it is an ever-present in our politics. And the question has been, what have you done over the many terms that you have been in government to raise the standard of living of Black people? Right. So there was a newspaper columnist, Professor Selwyn Cujo. He put out a very provocative column about a week ago to say that the PNM has failed Afro-Trinidadians and it's time to give the UNC a chance. Now, as you would expect, his quotes have appeared everywhere in the UNC political campaign, but that is an interesting dynamic. That's a very interesting dynamic in the race.
Yes, indeed. And so,
we can't get away from race. I wish it wasn't so, but I'm just presenting the reality.
Of course. And so there you have it, ladies and gentlemen. It is early as yet to have a call on the Trinidadian elections. In another 2 hours, of course, we would know a definite path ahead. UNC vis-a-vis PNM. Certainly, there seems to be no shaking at all of the main parties in Trinidad and Tobago. And so, ladies and gentlemen, tonight it has been a pleasure to have our discussion here with you all. We were joined earlier by Mr. Leonard Schumann, as you know, discussing Indigenous Peoples Day, which was yesterday, World Indigenous Peoples Day, and we'll continue to deliberate on that. And then later on in the program, we had Minister of Health, Dr. Frank Anthony, giving us an update on the health situation across the country and, of course, COVID-19. I want to remind you all, ladies and gentlemen, that as of this week, Room 592 goes back to what we started out as, and that is we're going to be aired on Mondays, Wednesdays, and Fridays. Let me repeat that to you. From today henceforth, Room 592 will be Mondays, Wednesdays, and Fridays, ladies and gentlemen. So the next time we will be seeing you will be on Wednesday evening. It has been a very, very interesting week, and we are certainly hoping that in Monday night's Room 592, we're going to have one of the senior most persons within the PPPC administration to talk to us about what really has been happening with all of these consultants and all of these political appointees that we are hearing about. We don't want to read it on social media. We want to hear it from the horse's mouth, so to speak, and I don't mean anything bad about any politicians who say horse's mouth. But
you're not calling names.
We're not. Thank you. We're not calling any names.
But
We certainly hope.
I wanted
tonight.
to ask Oren whether it was a good idea by the Trinidad government not to hire Mingo and Lowenfield to probably do something with the elections over there. I don't know. I'm just asking for everybody.
Yog, I think I've been very forthcoming on my answers over the many times you've had me here. This one has stumped me. I so far down the crease, I don't know how to answer that. I will just walk back to the pavilion.
Yes, let's leave that as is. So, Andrea Romana, you hit the nail on the head there, sir. That is exactly who we're looking for on Wednesday evening, ladies and gentlemen. We have invited no other than Minister of Parliamentary Affairs, Ms. Gail Teixeira, to join us on Wednesday evening in Room 592. So that will be an interesting discussion. And on Friday evening, we are hoping to have one of our diplomats join us here. We are waiting for confirmation, of course, before we tell you the certainty on that. So, ladies and gentlemen, as we start to wrap our program tonight, I'm going to deflect over to Mr. Leonard Gildarie to tell us about Wake Up Guyana.
Yes, it has been interesting today. We had Jackie Jackson in the house. I mean, that lady brought tears 2 times within 2 days, 3 days rather. We have some good talent here, Yoga, and I think back in your days at the GT&T, I think you would have probably taken notice of that Jackie girl.
Yes.
She was something else. But we are taking that Wake Up Guyana show to the next level in that we really having the people have their say instead of us talking a lot. We just break in and just, let's hear what's bothering you. What is it that you want the new government to do? And we continue from that. Let us see. But serious conversations here. The people are talking, and let's see where that goes. But it's a good thing.
Correct. And I wish to also give a public shout out to our friend Abel Sitaram, sir. I know that we have had our different discussions in the past, but feel welcome to come on the program. Just give me a call and we can make arrangements to have you here, as well as Mr. Gobin Harbajan. It would be good to have you guys on the program. And of course, all former ministers and public persons. We, of course, Room 592 remains very open for you to come and deliberate and for you to talk about, your own experiences in politics and so forth. Ladies and gentlemen, for tonight, we'll continue to keep our eyes, of course, on Trinidad and Tobago because, the elections in any country in the region is of interest to all the other countries in the region. And so we are going to keep our prayers and thoughts with our brothers and sisters there. I must remind you that in Trinidad and Tobago, Oren will tell me probably a more accurate figure, but over 1 million persons would have been catered for there, Oren, in these elections.
Correct, and which makes me wonder why we struggle to
400,000 here.
A voters register of 500,000.
Yes.
in decent time.
Correct.
I don't get it. We should, and very seriously, we should hold our our elections commission, and we should hold our public officials to higher standards. Returns on election night must be a must. We're not transporting ballot boxes from Pacaraima Mountains on the backs of donkeys.
Well, that's how it was designed to be, Oren. When they had that Carter mission and the agreement was brokered between the parties to post your SOPs out there, it was so that the SOPs formed the norm. And GCOM has been most surprising in hindsight, and we all knew it, that they did not proceed immediately with the SOPs, which was in everybody's possession. And I'll tell you something else that's interesting. I'm seeing, for example, the Trinidadian, you have a couple of, all your media houses have ongoing coverage of the results as they roll in. And, I'll tell you this, Oren, I don't know if you knew this, but ladies and gentlemen, you will all remember this, that GCOM had a special website set up to roll out the information as it was becoming available to them. I want you all to know that I and Leonard Gildarie, we welcome President Ali's announcement that a forensic review will be done of the Elections Commission. And I tell you why. That website that was set up was owned and controlled outside of Guyana. And all of those things we need to get to the bottom of. Yes, sorry.
Do you remember when we had Senior Counsel Ralph Ramkaran on? I was honored to be part of that discussion. Yeah. He said that some amnesties are going to have to be extended. I don't know if that, judging from what I've been hearing coming out of the president, I don't know if he's in the mood to do that. So it's going to be interesting how and when and how soon people are held to account for.
Correct. And I think also what's happening, Oren, is the president also has to keep his fingers on the pulse of the Guyanese people. We're all hurt, not by the individuals, but by whatever persons that might have caused such things to happen. Even if we were to identify them so that we identify the loopholes.
My own view is that we must make electoral fraud a deter. We must deter electoral fraud.
Correct.
And we should deal very, very seriously with it. That's all I'm going to say. It must be a deterrence. The way we deal with it must send out a signal. You should never attempt to do this again.
Absolutely. And thank you. And Oren, it's been a pleasure to have you here. I know we always call on you, and you have always been available.
Look, I'm sorry I can't give you final returns from Trinidad. If Leonard rolls out some coffee, we could go for a couple more hours.
That's all right. We don't want you to be the opposite and call it too early, you know. But ladies and gentlemen, we are getting to program time, and so let me thank you for joining us here in room 592 tonight, as we learned quite a bit from Minister of Health, Dr. Frank Anthony, and of course from our brother Oren Gordon, all the way from Trinidad and Tobago. And, you know, we had Leonard Schumann, and of course from my co-host, Mr. Leonard Gildarie. Our thanks to Kaieteur Radio for providing this airtime, and we certainly look forward for a further engagement with various ministers of government and persons in opposition, as we do know that very, very, very soon, the National Assembly will have to be put in place, will have to meet to start to sort out a lot of things in the country, including having funding available for the government to even spend. Ladies and gentlemen, it's been wonderful to have you here in room 592 once again. Do have a great night wherever you are. And please remember, say a prayer for this beautiful country of ours. It is still the best place on earth, and we got to get Oren Gordon back into Guyana. So ladies and gentlemen, it's been good to have you here. Do have a safe night. Bye-bye now.
Kaieteur Radio.
Covering Guyana from coast to coast.
Demerara and Essequibo 99.1 FM.
Berbice 99.5 FM. Kaieteur Radio.
Carnival, I love you so.